Hi, this is Jessica DaMassa with WTF Health. I am here at Upgraded Life Festival, and joining me right now I have Ville Mujunen. He is the co-founder and CEO of Ninchat, which you've described to me as kind of like a private label, white label Slack for healthcare, right?
That's right.
Yeah. And I want to come back to that in a second, but first I wanted to pick your brain on the startup scene here in Finland. So tell me a little bit about what's going on here from a startup perspective in healthcare. What kinds of things are people developing? What's the investment community like? Give me a little bit of a snapshot, a pulse of what's happening.
Well, Helsinki and Finland, the startup scene is really blooming. So, like in the healthcare, we are part of there's like largest startup accelerator called Maria in the city of Helsinki. Which is an old hospital converted
cool.
into a startup home.
That's cool.
And it's kind of like a quite compact city, so you can walk to the different places, and it's a strong community with a lot of international impact in there. But in top of that, kind of Helsinki, things work, things are digital. So when we're looking at the healthcare as an industry, so you can actually have access to data and build products and build artificial intelligence and all kinds of tools, so because the infrastructure is there, so you have the scientific data and everything, so it's kind of a perfect place to build a startup in healthcare.
It sounds like I've been hearing a lot of that, so about the Finnish ability for design as well as like the mobile history here, and then obviously like working with data and creating those very robust like data logistics type systems. So tell me a little bit about Ninchat and what you guys are doing, bringing all of these things together in this space.
So what we have a kind of the fabric of messaging. So we're looking at the healthcare kind of the processes. So what's going on? How can we actually help healthcare become agile? So looking into external patient communication, internal messaging, and also internal consultations. So when we're looking, for example, what happens when you have an appointment cancellation? How can you actually serve? Can you serve digital patients during that? Or if you're positioned in a rural place where you're having a couple of limited supply of patients, so how can we kind of use the whole population of healthcare professionals and adapt and measure? How can we help that? And that's kind of where the messaging comes in. Okay,
so you guys have this platform that kind of helps, almost like a traffic control for supply and demand in terms of providing communication.
Yeah, it's kind of amazing when it's also a game of critical mass. So in our platform there we're working with with the largest private clinic called the Health House, and they've got 200 doctors serving patients, and so that means that it's also real time. So when you're going to go to the doctor, you can go 24/7, and they answer in average 2 seconds. You're in a doctor, and in 8 minutes you're out. So it's kind of like a prescription renewed and care assessments done. And but this also it creates a new kind of way how people go to doctors. So you start to go from buses, cafes. So when you remember, I forgot to renew my prescription. So then you just click the button and done. It's done. So it totally changes the way of working.
Right.
And that's kind of when you make that measurable, so you can start to transform.
Right.
And that value, yeah.
So tell me where you're at from a company perspective. Are you guys raising funds right now? Are you trying to deploy and looking for partners? Tell me where you're at.
Right now we've been growing by bootstrapping from the cash flow. We are now in 5 countries, about 70 in Finland, Netherlands, Switzerland, UK, and Norway.
Okay.
So at the time, Europe is transforming pretty fast, and the legislation allows for healthcare services to be also telemedicine and all of that area. So now is the time to actually speed up. So we are having discussions for an investment round at the moment, so to kind of speed up the growth.
Good. Well, congratulations on that. And then, what are you, I guess, most looking forward to in the future? Not with your technology, but I guess like we talk a lot about different technologies being deployed to improve the experience in the healthcare space. From your perspective, as somebody who's in this market, what are you most excited about?
Oh, I'm really excited about kind of like about the change when we are starting to see that now we actually can make an impact. So we can have we already have seen that we have saved lives with these products because of the lower access to the healthcare services, and seeing that convert into reality. So having a work actually has a meaning. So that's maybe that drives us at the moment.
Very cool. Well, thank you so much for joining us. It's a pleasure to speak with you. I'm Jessica DaMassa at Upgraded Life Festival here for WTF Health. Thank you.